The essential components of assessing psychosocial, cognitive, and moral development in patient care allow us to understand that these domains of human development is critical for holistic nursing assessments. It allows us to offer age-appropriate care, identifying potential challenges, and support the patient's growth and well-being. As nurses, we frequently encounter patients at different stages of development. By recognizing these stages, we can guide our interventions and foster better health outcomes. Before beginning a developmental assessment, preparation is key. We need to ensure privacy and confidentiality. This creates a safe space for patients to share sensitive information. Establish rapport. Building trust encourages honest communication. For example, when a child is being assessed, using a calm voice and friendly demeanor helps alleviate fear. Use age-appropriate language. Adjusting our language ensures that the patient understands the questions and feels comfortable responding. A teenager may respond better to direct questions, while older adults may appreciate a more conversational approach. Consider cultural and personal values. Cultural sensitivity is vital. Understanding a patient's background helps us avoid misinterpretations and show respect for their beliefs. Explain the purpose of the assessment. Informing the patient why we are conducting the assessment reduces anxiety and increases cooperation. For example, when assessing a preschooler's cognitive development, using playful language like, "Can you show me how to play with your toys?" makes it easier for them to express themselves naturally. Developmental assessments focus on three domains. Psychosocial development by Erickson evaluates how individuals manage social and emotional conflicts at different life stages. Cognitive development, the Piaget's theory, examines how individuals perceive and process information. The moral development by Kohlberg analyzes ethical decision-making and sense of justice. What are the steps in the assessment process? 1. Conduct structured interviews using development-specific questions. 2. Observe behavior and responses during the interactions. 3. Compare findings to expected developmental milestones for age. 4. Identify concerns for delays and document findings thoroughly. For example, a patient in the sensory motor stage may not yet understand object permanence. When a toy is hidden inside or under a blanket, a 10-month-old should begin to search for it, indicating developing cognitive awareness. Erickson's theory outlines the 8 stages of psychosocial development, each representing a core conflict that influences personality development. Focus areas include trust versus mistrust during infancy. We need to assess if the infant has a secure attachment to their caregiver. During toddlerhood, autonomy versus shame and doubt, we need to evaluate a toddler's sense of independence, such as trying to feed themselves. During adolescence, wherein identity versus role confusion is the conflict, identify if the adolescent has a clear sense of self and future goals. We can ask these key questions. Who do you turn to for emotional support? How do you feel about making decisions independently? What are your personal goals? Example, a middle-aged adult experiencing stagnation in Erickson's generativity versus stagnation stage may struggle to find purpose in their career or family life, leading to feelings of dissatisfaction. Normal findings could include expression of confidence in their identity and decision-making, ability to form healthy social relationships, and able to demonstrate a sense of purpose and accomplishment. Normal findings could include struggles with self-identity and relationships, experiences of stagnation, purposelessness, or unresolved guilt, and difficulty trusting others. Piaget's theory focuses on how individuals understand and process information across 4 developmental stages: sensory motor, pre-operational, concrete operational, and formal operational. Focus areas for from birth to 2 years old, or the sensory motor stage, is object permanence and motor skills. From 2 to 7 years, or the pre-operational stage, egocentrism and symbolic thinking. From 7 to 11 years, or the concrete operational stage, logical reasoning and understanding conservation. During the 12 years and above, which is the formal operational stage, is the abstract thinking and hypothetical reasoning. Example is a 5-year-old who may struggle to understand that a taller glass does not mean more liquid, indicating they are in the pre-operational stage. Normal findings for this include age-appropriate problem solving and the ability to distinguish between real and imaginary concepts. Abnormal findings could include difficulty with abstract thinking in adulthood, lack of object permanence in infants over 8 months. Kohlberg's theory evaluates how individuals make ethical decisions across 3 levels: the pre-conventional, conventional, and post-conventional. Key questions that we can ask to assess include: why do you think it is important to follow rules? What would you do if someone or if you saw someone drop their wallet? Would you break a rule to help someone in need? For instance, a teenager may argue that stealing is wrong because it's against the law, while an adult in the post-conventional stage may say, stealing is wrong, but if it meant saving a life, it might be justified. Normal findings could include age-appropriate moral reasoning, empathy and social responsibility. Abnormal findings include justification of unethical behavior without remorse, making decisions solely based on punishment avoidance beyond childhood. The theories of Erikson, Piaget, and Kohlberg provide a framework for understanding human development in psychosocial, cognitive, and moral domains. This structured approach helps nurses identify normal and abnormal patterns, guiding appropriate intervention.